Hi there. I'm medically trained to some extent, and I thought it'd be quite good to put on YouTube a nice digest of some of the common medical conditions and try to put across some of the things that doctors do and explain why they do them. Because often in your consultations, you're rushed. There's not much time, or things are explained, but they're explained in complex jargon that no one really understands. So I'm going to try to put things across better in a series of presentations. The first one I'm going to talk about is stroke and TIA. TIA standing for Transient Ischemic Attack. Now, this is a big problem. It's one of the big three in the Western world. The big three are the things that cause either death or disability. And number one, just about everywhere, is cardiovascular disease. Generally in the Western world, that's number one. Cancer sort of varies between being number two and number three, depending on where you live. Obviously, it goes without saying it's a big killer and it's a big cause of disability. And stroke is there at number three. It's not so much a killer as more of a cause of disability. But I mean, if you've had one or you know anyone that has, and most people do, are abundantly aware of how disabling and how horrible a stroke can be. But the main reason why I'm talking about it at the moment is because stroke of those three is 90% near enough preventable. So what is a stroke? It's a sudden focal neurological deficit lasting more than 24 hours and presumably of a vascular origin. Now, for the doctors and medical students, that's the definition. And the key four things I've put in bold are sudden, so it happens within minutes. It's a focal neurological deficit, so it's not a widespread thing, it's not a random thing. It lasts more than 24 hours and it's due to a cerebrovascular problem. Now, for normal human beings, that means it's going to happen quickly. You're going to get symptoms in one specific place or on one side, generally, and it's going to last more than 24 hours, and it's of vascular origin, so it's your blood vessels that cause this. So what's the TIA? Well, TIA, as I mentioned earlier, stands for Transient Ischemic Attack or Transient Ischemic Event. It lasts less than 24 hours, and that's the only difference. So I mentioned the key thing in the definition there was it's vascular. So around 3/4, or maybe a little bit more, a little bit less, are ischemic. And what ischemic means is if you think about your blood vessels as pipes, basic plumbing, ischemic is when you get a block in your pipe, a block in the plumbing, and in this case a block in the blood vessel. So it stops blood flowing beyond that block. And the bit of tissue that's beyond that block gets starved of blood, therefore it gets starved of oxygen, and therefore it starts to die. 20 to 20% I've written there, I should have written 25%, I apologise for that, is hemorrhagic. Hemorrhagic is a burst pipe, it's a burst blood vessel, blood leaks out of the blood vessel, and obviously anything upstream of that point is not getting blood because it's leaking out before it gets there. Now there are four main vessels that supply your brain with blood. You have two carotid arteries that run up the front of your neck, and you can feel them either side of your voice box if you put your fingers there, and they're pulsing away. And you have two vertebral arteries, and they run down the back of your neck, and they all actually meet together in something called a circle of Willis, which is actually just a big circular blood vessel with lots of other blood vessels that come off it and supply different parts of the brain. Now, theoretically, having four blood vessels that supply one big circle means they have a lot of redundancy there. So essentially you have a lot of pointless vessels there. So therefore you should be able to effectively block a vessel or lose a vessel due to hemorrhage or whatever and still be okay. And that's true for many people. Many of us are walking around every day living perfectly normal lives, and we have one of these blood vessels almost completely blocked, and we're just completely unaware of it because all the other three are doing their job. And because of this way it's arranged in a circle in our brain, our brains are working perfectly well. However, generally speaking, when people have TIAs, those less than 24-hour attacks, it's usually due to problems with their carotid arteries, And another thing to mention is that these blood vessels, their real start point is essentially the heart. And some of the clots that cause blocks, the ischemic attacks, can come from the heart. And the common condition that causes this is something called atrial fibrillation. So the signs and symptoms. So symptoms are things that you talk to your doctor about. You say, look, I've got this issue. And signs are things that they find when they examine you. And usually it's weakness and or numbness that is sort of characteristic of stroke or TIA. And obviously for TIA it would last less than 24 hours. However, you can get visual problems, things like partial blindness or blurring of the vision. You can get vocal problems, so you may not be able to pronounce your words, or you may not be able to find the right word you want to say. Another thing is it can cause abnormal movements. Now again, for the medical student and doctor people, this is usually a posterior circulation stroke, usually affecting the cerebellum, but certainly not always. And obviously you will have abnormal movements if you have severe weakness and numbness. So what kind of treatment will this person receive? Well, they'll get some sort of imaging, and usually the gold standard is a CT scan. And from a CT scan you can diagnose at least 90% of strokes. They may or may not get an MRI, and they may or may not get things like an ECG, also known as an EKG, and that basically checks out what their heart is doing. And there's various other imaging that may happen. For example, they may ultrasound the carotid arteries, something called a carotid Doppler. You will almost certainly get some sort of medical drugs, and depending on whether it's hemorrhagic or ischemic, the drugs will vary. Now, if you are known to be an ischemic, therefore block in your blood vessel, which will be diagnosed from the imaging, and you're there within usually 3 hours, you'll get something called thrombolysis, which is a drug which will break down that clot and restore circulation as soon as possible to the bit of brain that's not getting it. And that usually works very well. If, however, you're not suitable for that for many reasons, you may get other drugs that help thin the blood and stop these clots forming or break down clots. Aspirin, dipyridamole, clopidogrel, warfarin are examples of these. If you've had a hemorrhagic stroke, therefore a leaking, bleeding blood vessel, you won't get any of these treatments because these obviously encourage bleeding and you don't want that. And for those people, if the bleed doesn't resolve itself, it's normally a neurosurgical intervention, so normally surgery. If you're deemed severe enough, you'll be admitted to a stroke unit, which is a special ward in the hospital designed entirely to deal with stroke patients. And being on a stroke unit alone is associated with around 25-30% improvement in reduced disability and also an improvement in reduced mortality, which is death. The next step is obviously rehabilitation. Some people won't need this at all. Some people will have a complete recovery within days, but some people will need help with rehabilitating and will need physiotherapy help and will need help around the home. And the final thing is secondary prevention. And this is where I mentioned earlier that stroke is largely preventable. There are many things that you can do to stop this happening and stop it happening again if you've already had a stroke or a TIA. Now, keeping your cholesterol down is one, and there are various things: exercise, good diet, and certain medications, typically medications called statins. Keeping your blood pressure low. Now, if you've already had a stroke, you should keep your blood pressure below 130/80. If you've not, it should be below 140/90. However, there is variation. I mean, when you check it, you generally have a bit more anxiety and it'll be a bit higher. And I mean, there are a lot of reasons why, when you take your blood pressure, it won't be 100% accurate. But as a general rule, if you can consistently get higher values than the ones I've mentioned, it would be wise to see a doctor as to how you could lower it. And again, it's much the same: diet, exercise, and there are medications if necessary. Smoking obviously goes without saying, and obesity, again, it goes without saying. These are two big issues rife in the Western world at the moment, and increasingly so elsewhere. And diabetes, if you're diabetic, obviously keeping good control of that. Thank you ever so much for listening. I hope this has been helpful.